dengan tim. Ini dia. Sekali lagi buat kalian yang mau ikutan bisa bareng-bareng nanti sama saya juga untuk ngobrol-ngobrol. Ya. Marco.
Hello.
Hello.
Good to see you.
How are you?
How are you?
Can you hear me?
Yes, I do. How are you?
Okay, I'm good. Good to see you, by the way. I think we haven't spoken that much during the
My honor to be your host, your guest.
Thank you very much for being my guest here. We're definitely going to talk a lot about this quarantine and what's happening in Italy at the moment. Because as far as I'm concerned, I just read the news about the increasing of the numbers, especially for the new country. It hits 120,000 cases, and new cases is up to 4,000 cases. Total death is up to 15,000. And first of all, I would like to also ask you, this would be my first question for you. I believe that you're having a very hard time at the moment. So first of all, again, Marco, thank you for joining me here live with Official Pilares. And most of the viewers are obviously Indonesian. But I hope that this interview or this talk would give another vision or information, and we can share about our story, what's happening in Indonesia and what's happening in Italy, because I think we all struggle the same thing at the moment.
Actually,
Marco,
I don't know if you
please
hear me correctly, but the line is weak. You're breaking a bit. But
I'm breaking a bit. Is it okay now?
Let's try. Let's on the pandemic, we need to do something and be optimistic. Go ahead.
Right, because I can hear you at the moment very clear. So first question would be, can you share with us the recent situation in Italy about the pandemic of COVID-19?
Okay, so thank you very much again, and all of your guests online. It's an honor to be with you. I hope you, Reza, are doing fine, and thanks again for supporting ActionAid YAPPIKA. Here, the situation, as you can see, I am in house. I cannot move for a month now, and my situation is the same situation as for everyone else. The population is forced to stay in. As you say, there has been thousands and thousands of victims, and unfortunately, those victims are those that are regularly accounted for, because as you know, the virus hits particularly the elderly people. So there are some people that do not even manage to get to the hospital. So in practice, unfortunately, we know that the victims of virus are many more than those officially accounted for. We are for a few days by now trying to be hopeful, because the curve of contagion, again, official numbers, is slowing down a little bit.
So is it slowing down at the moment?
At the moment, for the last 4 days, the curve of contagion and the curve of death is slowing down. It doesn't mean that there's less. It means that it's not growing faster as it did at the beginning of the pandemic. Which means that some of the measures that the government has recommended or even forced us to follow are probably having an effect. Of course, there is also a lot to discuss about not just the health crisis, but what it will mean for the countries, all of our countries, actually being locked down for long time because that will definitely have a social and economic. So we are already thinking forward of that, what that might mean. But yeah, I think awareness of how we have to act as people, every individual, to actually contain the contagion is probably what you and I want to discuss. It will apply to Indonesia in the same way as to Italy. So yeah, it's a responsibility of the government.
Yeah, Marco, I hope you will excuse me for speaking in bahasa at the moment to my audience as well who's watching this live. Saya sedang berbicara dengan Marco di Ponte yang adalah Secretary General ActionAid Italy. Dan percakapan ini akan berbicara seputar bagaimana perkembangan kasus COVID khususnya di Italia, dan kita akan berbagi informasi tentang apa yang terjadi di Indonesia dan juga yang terjadi di Italia. Saya akan merangkum pembicaraan ini tentunya untuk kalian semua, tapi pada saat ini yang mungkin bisa mengikuti dan bisa gabung dan ada pertanyaan juga silakan. Nanti akan saya tanyakan ke Marco. Karena tadi saya bertanya seputar bagaimana perkembangan kasus dengan angka yang cukup tinggi, karena Italia ya, dengan jumlah kasus COVID tertinggi, dan saya akan lanjutkan pembicaraan ini dengan Marco supaya kalian juga bisa terus mendengarkan. Dan terima kasih yang sudah bergabung sebelumnya. Mohon maaf kalau misalnya mungkin ada yang kurang paham. Saya akan mencoba untuk menjelaskannya secara sedetail mungkin kalau bisa nanti. Tapi tetap ikuti percakapan ini, dan buat yang mengerti silakan juga ikut bergabung untuk memberikan pertanyaan-pertanyaan yang kalian inginkan untuk untuk kemudian nantinya bisa saya tanyakan juga ke mana nih, saya nggak kelihatan, ke Marco. Lepas aja deh. Yes. Nah, I'm really sorry, Marco. Trying to get the best position for all of this.
Actually, are you any longer?
That's it. You were explaining about the majority of the situation at the moment. Can you hear me?
Badly, but I can still hear you. If you can hear me, it's okay.
No, the connection is pretty bad. Can we turn off the Wi-Fi for the moment? And let's see from there. Back to you. Is it okay now? Is it better? Can you hear me better?
It's better now. Yeah.
Okay, it's better now.
Terima kasih.
So, sama-sama Marco, terima kasih banyak. You know that how is the people are reacting to this lockdown in Italy, and how they respond to this kind of condition? I mean, your country announced a lockdown since 1.5 months or 2 months ago. Is that right?
Actually, it was a progression. About 2 months back, we started to limit circulation, and we are in full lockdown, which means people cannot circulate except if authorized for 4 weeks now. So, yeah, thanks for asking that, because I think there are different elements to it. Of course, there is sort of individual psychological element to it. People start getting nervous. Some of them have small houses. They have to live together with the family. It's always complicated. On the contrary, some other people are lonely, so they suffer for being lonely for a month. And this is, the psychological impact of the whole thing. It's complicated. But I think there is an awareness that we have to do it. So, so far, it is managed more or less correctly. Of course, like in any people in a culture where we are very inclined to have social contact because we live out in the street, I think somehow, like Indonesian people, not everyone is complying. and there is collective discipline element to it. The government had to enforce some people that were not complying because they put at risk everyone. And this is why I was saying it's both an individual act as well a structured government action that combined will produce results. Every individual has to acknowledge their power of contributing or their power to not contributing by violating the rules. So I think, those two are elements that need to be taken into account. And then the third, if you want, reflection has to do with the preoccupation for the possibility to continue to work.
Right.
Because all companies are closed down, we're not producing wealth, and some people that are irregularly employed, they just cannot go out, so they don't have any revenues. So the big preoccupation is not so much about the infection itself, but it's about the future of the country and the future of, possibility to generate revenue for your own family and for your own future living. So this is like three elements coming together.
Okay. I think we're all aware of the profound social and economic consequences of the pandemic, and it has also affected the economies of the communities and nation. As in the income of individual and families, like you said, it also affect that kind of sector. How, when people are staying at home, like you said previously, how do they manage to get like the basic needs, like daily needs? For food or food supplies or water supplies and everything, how do they manage, and what is actually the government do in terms of this kind of condition? Can you please explain that a little bit to me?
Yeah, sure. Thanks for asking that. The practical daily life is regulated. You can only get out with a written authorization that you have to show to police to go for food shopping. You cannot do anything else. So when you have this written paper, if the police stops you, you have to demonstrate that you are only going from your residence to food shop and come back. And when you are in the food shop, everyone can only enter one by one, keeping the due distance. So everything is very regulated in that respect.
Yeah.
What government is doing? The government is doing many things, trying to inject credit for the companies to remain viable when we start opening again, little by little. And it's injecting in the system quite a lot of resources to make sure that those that do not have a revenue can survive. It's very complicated. I will not be, tiring you with the details, but basically they are conceiving something like a universal basic income for only the 2-3 months that we have to be locked in, which means the government will pay very limited amount for people to survive. Of course, this has consequences because where do these resources come from? They come from the coffers of the state. That will mean that we will increase the debt service that the government will have to pay year on year, which in turn means that over the next few years there will be a tightening of expenditure by the state because they will have to pay for the debt that is created now. So it's a very complex economic situation. And we are negotiating as a founding member of the European Union for help from the other countries in Europe. It's a big debate. How much do we socialize the economic impact? And there is an interesting divide between the countries in the north that don't want to contribute much and countries in the south of Europe, like especially Italy and Spain, that is also very badly hit to request for that support. So again, what the government is doing finds its limitations in the resources of the state and in the resources of the European Union. But we are hopeful that there will be solidarity. Actually, we have been receiving solidarity from so many countries. We got medical doctors from Cuba, from Albania, even very small and very not resourceful countries. So we don't see why we cannot expect solidarity from the likes of Germany and France, for example. But that's the current debate.
That's the current debate. But so you're saying that you're getting help from countries that you don't even expect that would your country as well during this coronavirus.
Yeah, that is, of course, sending in 30 doctors from Cuba, for example, that has happened, or getting medical supplies from China, that also has happened, is more symbolic because it's a one-off thing. A huge economic stimulus, like we are negotiating with the European Union, which should be 700 billion euros, if you can make calculations. It's like a different type, very refreshing, I have to say, to see either very small or poorer countries to actually come in with the means that they have to show solidarity. I think this is a great lessons for us individuals across the world, and this is, for example, what unites us with YAPPIKA in Indonesia, and we know that the solidarity is there, both ways.
Okay.
Always.
Is there any prediction from the health experts or from the government about when is the crisis will be getting down, or at least it's getting better, or it's slowing down, not rapidly but slowly?
This is the big question everyone asks. I think, as I said, that we are starting to see some signals that we are curb the epidemic, but I think one thing that maybe will apply to Indonesia as well is that, you know, we never have to hurry to think that what we're doing is enough, because the worst case scenario is that you may do many efforts, remain locked down for many weeks and months, and then you let it outbreak again. So the government is being very cautious. Okay, we're starting to see some interesting results, but we have to be patient.
Okay.
And I think we have to, as I said before, we have to be patient as a country, as institutions, and also as individuals, because as you can imagine, it is hard. I have my kids 700 kilometers away from me, and my partner, that you know, that is Noor, is living in another country. So we have to be patient as individuals, and we'll get out together. So I think this is the lessons that might be useful to listen to even in other countries. It's not one-shot effort. It requires long-term vision. We have been hit first or second after China, but we are offering an opportunity to other countries to maybe not make the same mistake, not hurry up, not doing things more properly. And I think this is you have a little bit of advantage of time, so you should use and learn,
right,
and manage better, actually.
Okay. There's one interesting question from Hari Azari. How does ActionAid Italy respond to the COVID-19 case there beside Italian government has done to reduce the spread of the coronavirus? I think this is a very interesting question. Can we respond to that?
Yeah, sure. Okay, we do 2 or 3 things at different levels. At one level, I've been advising on the economic package that the government is providing, basically expressing concerns that the most impoverished people would be taken into account, which in our case means basically all those that are in informal work that are not recognized. You can call it black market. There is about 1/10 of the population that is in the informal economy, and we are saying, okay, the state needs to accept that there will be mistakes. Maybe some people will try to exploit the situation, but in this very moment, you cannot be too complicated. You have to be distributing resources to basically whoever asks, because otherwise they will be left behind. A great number will be left behind. And amongst these people, there's of course people of Italian origins. There's a lot of migrants as well that are not regularly in Italy, but because of that they cannot access to hospitals, they cannot be cured, and in themselves represent almost a biological bomb if you think of it, because they are not accessing the system. So that is one level, getting advice to the government. Then we have done a few specific things. I cannot list them all, but one thing that we have been doing, for example, is monitoring and observing how violence against women is addressed or cannot be addressed during a situation like this. When people are locked down, people report less about
domestic
crime against women. So we are trying to make sure that the cases are still registered and action and safety can be guaranteed to the people that require protection. Same thing we are doing with, as I said, access of migrants to services that are not available in general, but now are even less available. And a number of many other things that we need to adjust to as an organization as well, because the power of the so-called third sector, not-for-profit organizations and civic organizations is so important. We are basically, as an organization, providing many services instead of the state, or supporting the state. So ability of our staff and the staff of other organizations to actually do their job properly is determined by, for example, access to medical supplies like masks, very simple things. So we are also working with the government to ensure that a not-for-profit organization can operate of safety, protecting our staff. But everything has changed, Reza, so we have to recognize that every day there is a new decree. We are also interpreting the need of the people. One very interesting thing that we have been doing, for example, is to allow people to help people without mediation. We set up a website where needs can be logged in and can be responded to, and that is called COVID-19 Italy.help. Yeah. So basically, we set up this platform, and if you are an elderly person that needs support to get in food shopping, you can log in, and somebody will help in your neighborhood. So we are connecting people directly, even irrespective of the governmental presence, and many other things.
Okay, I think this is very interesting. You're just saying that you have this kind of so-called source where people can actually check or help the elder people to get supplies, like for food supplies and everything, if they cannot go out and sort of things. And I think this would be very helpful. But do you know the situation in Indonesia at the moment? We actually put this kind of social distance in a bigger scale for the people. We are not yet to lock down, and I don't think that would be the plan for the government to lock down this country. Do you have any perspective for that? I mean, your point of view.
Yeah, bear in mind that it's only my perspective, so I'm in no position to advise what to do in another country, but and I think those that are listening to us have to take this into account. But I think in general, governments across the world has been much trying to balance the economy with health. Maybe addressing the health concern a little bit earlier will also benefit the economy. And in this I think potentially healthy relationship between the people and government, I think if the people tend to be stricter in applying recommendations, that would benefit the community. So I don't know if you will have to go to complete lockdown, but I mean, act earlier than later. That's a general advice because we are paying the consequences for balancing too much, I think.
Okay.
And they are, I mean, it's not about attacking the government, because the government has the responsibility to balance all interests. But close down one day earlier, do one walk to the food shop less, take 2 meters instead 1 meter of half distance. You know, everything, caution, and respect for the health of the other will win. I think, if we are all aware.
Another question from the audience as well. I think this is also an important question. What about the bodies of the infected persons? Or I mean, do you mean for the people who are actually dying because of this? Is there any enough room for the funeral process? Because I read about it in the news about the lack of space due to the rising death rates. Is it?
Yeah, this is a very sad part of the whole thing, because the people that are dying in isolation. So even before we go to the management question, people are dying in isolation, which is very bad for them. It's also very bad for their relatives. They cannot see and accompany through the most important passage of life, and that is draining for everyone. Every one of us have seen directly or has been in touch with a person that got to that stage. When people die, to be managed differently than any other people, because they still carry the virus. So they you know, when the system, like 1 or 2 weeks back, the health system was really collapsing, very specific cities where it was worse than anything else, because they were small villages, and you know, they didn't have obituaries, they didn't have enough space. So on top of everything else, those bodies had to be transferred to other places, and that could be done. It's not the most difficult thing, but it is very difficult for the people that are forced to stay at home and unable to pay respect anyways to their loved ones. So as I said before, there's also a psychological element to that. It's most of the people have been elderly people, but not being able to pay respect, I think also in Indonesian culture, is a big demand on the relatives that will have to continue to stay in house and cannot do what they would normally do when they lose someone. Now, there has been a few images of the army moving coffins from one place to the next, and that,
I saw that as well.
Basically made an impression on the whole country. You know, I think even media, I mean, have a responsibility of, in a way, showing what needs to be shown, but conveying a hopeful message rather than a message of gloom and gloom. So I think we also have to work on that. Always telling the truth, but not making it you know,
scary or
impression of 50 million people that everything is going to be bad forever. No, we shall overcome.
Okay, so you're also saying that the way the government, you've explained how the government is handling the situation in Italy and how the people is actually cope with the situation as well. But how do you have any specific answer to that? I don't know if you can answer this or not, but I'm just trying to ask you about this. I think this is also important. Knowing the amount of people that affected of this coronavirus. How do you see that this case is improved by the government, the way they help the people and all the organization that might help the people? Is it improving at the moment? Or what do you think about this?
I think the country as a system, as a body, living body, so government, intermediary organization, etc., have actually responded exceptionally well.
Okay.
Because everyone is basically facing new world, but we are trying to adjust. And honestly, there is always a lot of division across the political spectrum. For example, that has paused a bit. We understood that there is something bigger to fight for. And I can see that this is happening in other countries as well. We have a common struggle to focus on, and I think it is happening. What is a big question mark is how long that expression of solidarity will last, because of course people also get tired.
Right.
But so far, we have responded well with the systems and especially with the approach.
Okay. I think I really hope that we can also apply that thing that you just explained, because I think it is really a good example of how you have a homepage of people that can access. If you need help, if the elder people need help, maybe the younger people can help it out by contributing or buy supplies for them, because I saw these things happening in England as well. So I think that's a good example. Do you have any message for YAPPIKA-ActionAid Indonesia?
Well, not particularly for YAPPIKA. They are my beloved colleagues. I want to absolutely thank you for giving a little bit of exposure to their work. I have a little bit of message to whoever is listening, which is basically, be careful. A lot depends on you, individuals, what yourself and what you do for the others. And I'm sure my colleagues will cooperate with institutions and governments and the people that have visibility like you, dear Reza, to make sure everyone listens to that message. And it will be hard days and weeks. You have to know if you go through. But we will overcome together. And I think it's fantastic that for countries so far away like ours, we can share experiences. I also think, 50 years back, that would not have been possible to learn from one another. Let's see what is positive, and let's take action.
Marco, thank you so much for joining me. I think this is a very important conversation that we had. Again, thank you so much. I wish you all the best there. Stay healthy, stay safe, and hopefully this whole COVID-19 things will be gone as soon as possible. Again, thank you much for sharing.
Terima kasih. That is the time when I will come back to Jakarta with great pleasure.
I hope to see you in person.
Face to face and hug you.
See you in person, face to face and hug. Right. Thank you very much.
Thank you. Ciao.
Thank you, Marco. Ciao.
Bye-bye.
Bye-bye. Gimana nih? Enggak. Belum. Gue masih mau lanjutin dulu sebentar. Caranya. Oke. Ya tadi obrolan saya sama Marco, karena memang dibatasi waktu, ada beberapa pertanyaan yang saya sebenarnya bisa tanyakan tadi, dan mungkin kalau bisa saya hanya akan berusaha untuk merangkum sedikit aja, bahwa percakapan kita tadi adalah seputar tentang kondisi COVID-19 di Italia. Seperti yang kalian tahu mungkin dari banyak laman berita juga banyak yang menyatakan bahwa Italia cukup menghadapi masa-masa yang sangat sulit karena memang mereka di Eropa sendiri cukup tinggi kasusnya, dan di dunia mereka ada di urutan ketiga. Per tanggal 6 April 2020 ini aja perharinya Itu mereka ada pertambahan kasus sebanyak 4.316 kasus dengan total meninggal dunia ada 527 dengan total kematian 15.889 dan tadi ada hal yang cukup menarik juga disampaikan oleh Marco terkait dengan bagaimana cara mereka juga berusaha untuk menanggulangi beberapa hal yang terjadi di Italia. Salah satunya adalah dengan adanya sebuah web atau homepage di mana kita bisa akses ya, terutama mungkin yang lebih muda untuk membantu para senior residents atau mereka-mereka yang sudah berada di usia lanjut atau usia-usia yang sangat rentan, terutama untuk terkena COVID, untuk menjadi volunteer dan ikut. Itu bisa dimulai, kalau di Inggris saya pernah lihat di berita itu dimulai dari lingkungan-lingkungan terdekat. Jadi didata berapa orang-orang yang sudah lanjut usianya dan mungkin tinggal sendiri atau mereka berdua pasangan suami istri yang anaknya mungkin jauh beda kota dan mereka nggak ada yang ngurusin. Mereka biasanya bisa keluar tapi sekarang mungkin harus ada di rumah untuk keamanan mereka juga, dan mungkin ada yang bisa akhirnya membantu di tetangga-tetangga sekitarnya yang lebih muda untuk mengecek, memberikan perhatian lebih apakah mereka sudah tercukupi mungkin makannya dan lain-lain. Saya rasa mungkin itu juga bisa jadi satu contoh yang cukup baik ya, mengingat kita juga tidak dalam posisi lockdown saat ini. Karena tadi saya juga menanyakan hal tersebut, apa pandangan Anda kalau misalnya di Indonesia kan saat ini kita sudah diberlakukan pembatasan jarak berskala PSBB, pembatasan sosial berskala besar. Dan orang masih bisa ada aktivitas di luar, terutama memang karena memang sangat sulit sekali mungkin untuk membuat lockdown, karena yang saya tahu, koreksi kalau informasi yang saya tahu adalah kalau lockdown itu berarti betul-betul semua hal diambil alih oleh pemerintah pusat dan betul-betul itu akan memberikan dampak yang luar biasa besar bagi ekonomi-ekonomi yang juga bergerak dalam skala kecil. Saya rasa ada banyak sekali yang akan mendapatkan kesulitan lebih banyak lagi mungkin dengan hal tersebut, dan ini sangat debatable, ini sangat bisa diperdebatkan tentunya, dan mudah-mudahan di kondisi yang saat ini orang-orang yang mungkin punya privilege untuk bisa stay at home dan tetap memenuhi kebutuhan mereka bisa betul-betul stay at home dan menghindari berpergian terlalu banyak, apalagi yang kalau hanya dan lain-lain, terkecuali mereka-mereka yang memang tidak mungkin tidak keluar rumah, kecuali ada bantuan yang betul-betul konkret ya. Kalau belum ada, bingung juga mau stay di rumah, tapi kondisinya begini, bantuannya mungkin belum datang, mereka harus memenuhi kebutuhan hidup hari-hari, terus gimana gitu kan, itu juga harus dipikirin gitu. Dan saya rasa itu banyak banget orang yang harus mengalami kesulitan tersebut. Jadi mudah-mudahan kondisi ini bisa cepat pulih, tentunya itu harapan kita semua. Lalu kemudian bagaimana pemerintah di Italia juga merespon kejadian ini. Kalau menurut Marco tadi di Italia sejauh ini baik itu sih maupun pemerintahan sudah cukup melakukan atau mengambil kebijakan-kebijakan yang sangat positif pengaruhnya untuk pengendalian kasus ini, karena mereka juga cukup mendapatkan bantuan walaupun dari negara-negara yang kadang-kadang mereka bahkan nggak expect gitu ya. Kayak Marco tadi jelaskan ada bantuan dokter, 30 dokter medis ya dari Kuba, dari Albania gitu. Sementara mungkin dia berpikir masing-masing negara lain di Eropa, di European Unionnya sendiri sedang menghadapi kesulitan yang juga cukup besar, sehingga agak sulit mungkin untuk bisa mendapatkan hal tersebut. Itu menurut yang disampaikan Marco tadi. Kemudian bagaimana masyarakat merespon aturan atau kebijakan yang dibuat untuk mereka sendiri, ternyata memang sangat dipatuhi. Artinya mereka betul-betul strict ya, peraturannya sangat tegas. Stay at home, kalaupun mereka keluar akan ada pemeriksaan, dan betul-betul dipastikan untuk memenuhi kebutuhan pangan di rumah atau basic needs yang mereka butuh. Mungkin itu. Dan buat kalian sekali lagi, saya membuka sekarang pertanyaan sedikit sebelum kita tutup. Masih ada waktu 5 menit lagi sebelum saya tutup untuk bertanya. Saya hanya harus mengingatkan saja bahwa ada bersama YAPPIKA-ActionAid Indonesia ada kalian bisa ikut untuk berdonasi di kitabisa.com /, ya itu kerjasama dengan YAPPIKA-ActionAid Indonesia, dan kalian bisa ikut kontribusi juga di sini untuk membantu saudara-saudara kita yang mungkin saat ini sedang mengalami kesulitan yang luar biasa. Oke. Mungkin tadi ada yang bertanya, saya sering megang-megang muka gitu. Iya, tadi itu betul, itu salah sebenarnya, nggak boleh megang-megang